Hello, everybody. We're outside of the offices of CBIA, an organization that carries the water for big business and big health insurance here in Connecticut. CBIA symbolizes what we're up against in the fight for quality, affordable health care. The vested interests that are trying to buy their way out of our health care that will give decent working families security and peace of mind, and small businesses the chance to thrive and create jobs.
Wait a minute here. CBIA is not the enemy. We're not the bad guy here. We're only trying to protect innocent people and businesses from the health care that the government is going to run. Corporations know what is best for our country. Look at the latest rulings of the Supreme Court. Did they back us up?
Listen, fat cat, do you understand what the name of your company is, your organization? It's corporations before individuals always. And we're not going to stand for that here in Connecticut. CBIA belongs to the U.S. Chamber of Commerce that spent record amounts lobbying against health care reform. You don't care about the little guy. You only care about your bottom line. Did you see the national report that came out last week? It said that healthcare reform would actually create 4 million jobs nationwide. 4 million jobs we could have if we created healthcare reform. But no, you're stopping us from having those 4 million jobs, Mr. Fat Cat. You're so busy protecting Aetna, Anthem, United Healthcare, and all your fellow Fat Cat insurers that you lost sight of is really good for business and the people of the state.
Calm down. You were getting your facts all wrong. The CBIA did not protect the insurers. Who would? Yes, you are so misunderstood, and we are so misunderstood and unappreciated by the general public.
You know why you're so unappreciated? We'll tell you why right now. Let's ask the crowd to list some of the ways health insurance companies let them down every day. How about it? Anybody in the crowd have any examples? Yes, ma'am.
How about the person who raising my premiums 43% this year? Explain that when you're raking in corporate profits, mister.
And they dare explain that, Cat, because they claim that I have a pre-existing condition.
And they turned down my claim for Lyme disease because they said it was experimental.
What about that, Fat Cat?
They raised my small business's premiums 35% because 2 employees turned 50. That's not fair!
And on it goes. So, what do you have to say for yourself?
Wait a minute. Those are just a few exceptions in this crowd. How many of you have insurance that are happy with what you're paying?
When you get involved in the healthcare debate, you have different sides looking for different things in terms of what healthcare reform should be. We have been pushing very strongly for healthcare reform. Healthcare reform that actually does something that reduces costs, that improves quality, and that's how we're going to get more access. Others would like a government-run system and a more of a government-controlled situation. We totally oppose that, but that does not mean that we oppose healthcare reform. And I thought there were some very interesting numbers that were recently released in a couple of polls, one by Quinnipiac and one by Rasmussen. Quinnipiac found that 54% are not happy. They disapprove with what's going on in the federal government and the 2 bills that were considered and passed out of the Senate and the House. However, 54% don't like the 2 bills. 52% said that we should do something. We totally agree. We are absolutely hopeful that Congress and the state legislature does something with health care reform and passes something that actually works. We just believe that going down a road of government-run, public option, whatever you want to call it, is not getting at true reform. You can be opposed to government-run healthcare and be pro-healthcare reform, which is exactly where we and the rest of the business community are.